Hello, my name is Joy Ajiboye. I'll be using Pillow as my patient. Hello, good morning. My name is Joy Ajiboye, a student nurse at Mountain View College. I'll be taking your vital signs and your physical assessment. Is that okay by you? Okay. Anytime I touch you, I will let you know. And if you have any problem with that, please let me know. I'm performing my hand hygiene and I'm putting on my gloves. Okay, please can you identify yourself by telling me your name and your date of birth? Mr. Smith, May 18, 1980. Okay, which is okay with what I have here. So, I will lower, um, I will adjust the bed to a working height and also lower the side wheel and provide privacy. Mr. Smith, before I take your vital signs, I would like to ask you some few questions. Did you just have a cup of coffee, cold drink, or are you chewing gum? He said no. Okay, so the next thing I'm gonna be doing is I'll be taking his radio pulse. For his radio pulse, I'm gonna be doing that for 30 seconds. Can I please have your hands? His radio pulse is 30. 30 times 2 is 60, which I've written it down. The next thing I'm going to be doing is his respirator. So he's checking his respirator. He's not going to be aware so that his heart is not going to beat so fast. So I'm just going to pretend like I'm still checking his radio pulse. I'm checking his heartbeat. His respiration is 6 times 2 is 12. I checked it for 30 seconds. So the next thing I'm going to be doing is his temperature. His temperature is 98.5, which I've written it down. The next thing I'm going to be doing is his pulse oximeter. His pulse oximeter is 71, which his heartbeat is 60. So when I try to compare with that of my patient, I found out that it's okay. The next thing I'm going to be doing is his blood pressure. His blood pressure for the systolic is 120, while the diastolic is 80. Which I've written it down. Mr. Smith, do you have any pain? Do you have any pain? Can you rate your pain? 0 means no pain and 10 means extremely painful. He said no pain, so since no pain, no medication. So I have gone through his vital signs and I will compare that with the assessment baseline data to that of the doctor. So Mr. Smith, can you tell me where you are? Hospital, what are you here for? Physical education, physical assessment. Can you tell me what is today's date? Okay. Do you have any allergy, like food or drugs? No allergy. So I'm checking around to see if he has any IV flu or any oxygen, which there is none. I've already provided privacy. So the next thing I'm going to be doing is I'll be looking at his skin, hair, and nails. I'll be looking to the skin with every part of assessment. I'll be looking at its texture, color, mobility, edema, lesion, body body hair and piercing, and I'm also look at I'll look at for every bony prominent pressure. So the next thing I'm going to be doing is his hair. Um, I'm looking at his hair to see if he has any missing hair or any thin hair, which there is none. And also I'm looking to see if he has any bed bud or any lice, which there is none. His hair looks good and healthy. So the next thing I'm going to be doing is his nails, Mr. Smith. The next thing I'm going to be doing is his nails. Mr. Smith, can I please have your hands? So his nails is appropriate for curvature. Is appropriate for curvature, and also I'll be doing the blanch the blanch test by making sure that the capillary refill lasts for 3 seconds. So the next thing I'm going to be doing is his symmetry of his face. Mr. Smith, can you glance at me, please? So I'll be looking at the eyes, the nose, and the ear, which they are the eyes. I'll be looking at the nose, the I'll be looking at the eyes, the nose, and the ear, which are all symmetry. So the next thing I'm going to be doing is his cranial nerve. Mr. Smith, can you the next thing I'm going to be doing is his cranial nerve. Mr. Smith, can you smile? Can you frown? Can you puff your cheek? Can you open your teeth? Do you have problems seeing far or near? Okay, no problem. So the next thing I'm going to be doing is his eyes. I'll be looking using the pen light. I'll be using the pen light to look at his eyes for if the pupil is equal, if his reaction to light reflect and accommodate. His eyes is small and is reactive to pen light. Mr. Smith, can you look straight to the pen? Side, up, down, angle. Look straight to the pen. Okay, so the next thing I'm going to be doing is his ears. I'll be looking at what I can see with the pen light with his ears. No drainage or lesion. No drainage or lesion. Since there's no drainage, there's not the in his ear, there's no drainage or lesion. They are both symmetry. So the next thing I'm going to be doing is his nose. I'll use the pen light to check his nose to look if to look if the nose is clean. No polos. No polos. His nose is clean, and also I'll use my hand. Can you take a deep breath? Deep breath. Okay. So the next thing I'm going to be doing is his facial sinuses. His facial sinuses. I'll be using my two fingers to check his cheek up and down. Do you feel any pain? Do you feel any pain? Okay, no pain. So the next thing is his oral cavity. I'll be using my pen light to look at his throat, tongue, and his teeth. Can you please open your mouth? His mouth is moist. His throat is pink. No redness. So the next thing I'm going to be doing is the range of motion. So for the range of motion, Mr. Smith, can you raise your shoulder? Can you raise your hands above your head? Down. Do you feel any pain in stiffness of joints? Okay, no pain. So the next thing I'm going to be doing is his lungs. So, Mr. Smith, can you sit up, please? So, in checking his lungs, the left hand side is 2, while the right hand side is 3. So this is the right hand side, and this is the left hand side. Take a deep breath, deep breath, deep breath, deep breath, deep breath. So, Mr. Smith, do you have any cough or shortness of breath? He said no. So the next thing I'm going to be doing is his heart and vessels. I will listen to his heart. I will listen to the PMI. That is point of maximal impulse. I listen to the eight pecu pulse, which I'll listen to the eight pecu pulse. This is the mid clavicular, fifth intercourse, and space 5. I'm listening to the X1 and the X2 sound. Okay. So the next thing I'm going to be doing is his carotid anterior and his jugular vein. So for the jugular vein, can you please turn your head to the other side? The jugular vein, there is no distension, and the carotid. I'm also checking this carotid. I'm also checking his carotid. So there is no turbulence. The next thing I'm going to be doing is his radial pulse. So for his radial pulse, I'll be using my 2 fingers. Mr. Smith, can I please have your hands? Can you push your hands against? Can you squeeze your hands? Okay, his hands are strong. So the next thing I'm going to be doing is his abdomen. I will listen, and I will percuse, and I also listen to the sound and palpate. This is the right. This is the right side, and this is the left side. So I'm also looking to see if he has any scar or lesion, which there is none. This is the right upper, left upper, left lower, right lower. So the next thing I'm going to be doing is I'll percuse. I'll be using my 2 fingers to percuse. The next thing I'm going to be doing is his bowel sound. Mr. Smith, when last did you urinate? What color was it? What color was it? Was it normal? When last did you have your bowel? When last did you have your bowel movement? What color was it? Was it normal? Does it smell like the normal ones? Okay. So the next thing I'm going to be doing is his muscular system. So for the muscular system, I'll be checking his nails. Can I please see your nails? No edema. No edema. Can you raise your nail up, down, up, down? Can you push your feet against my hands? Push your feet against my hands. And also I'm checking to see if there is any edema. No edema. I'm also checking the bottom of his feet. No edema. No edema. So the next thing I'm going to be doing is I'll be doing the pedal pulse by using my two fingers. So no edema. They are both bilateral and there's no edema. So I'll be taking off my gloves and perform hand hygiene. The next thing I'm going to be doing is psychosocial by making sure that my patient is safe. Mr. Smith, who did you come with to the hospital today? You came alone. Um, do you feel safe at home? Who do you live with? Is there anything that you want me to address that I did not address? So while I'm doing that, I will also while I'm doing that, I'm pulling it sideways down, and also I'll lower the bed also, and I'll unveil the privacy, and also I'll put the cowbell at the side, Mr. Smith. If you have any problem, you can just call. You can just call the cowbell. I'll be right with you. Thank you.